If you or your doctor suspect H. pylori infection, perhaps because of ongoing stomach pain, nausea, or unexplained digestive issues, it's important to get tested. H. pylori is a common cause of gastritis and ulcers, so identifying it early can make a big difference in your health and comfort. Fortunately, there are several reliable and widely available tests that can confirm whether H. pylori is present in your body. One of the most common is the urea breath test. It's quick, non-invasive, and simple. You'll be asked to swallow a special liquid or tablet and then breathe into a collection bag. If H. pylori is present, it breaks down the substance and the change is detected in your breath sample. This test is highly accurate and often used both for diagnosis and to check if treatment has worked. Another excellent option is the stool antigen test. This test looks for H. pylori proteins in your stool. It's not only accurate for initial diagnosis but also for confirming that the infection has cleared after treatment. It's especially useful for children or people who can't do the breath test. Blood tests are also available. They can show if you've ever been exposed to H. pylori by detecting antibodies in your blood. However, these antibodies can remain even after the infection is gone, so blood tests can't tell if the infection is still active. That's why for most people, breath and stool tests are preferred when checking for an active infection. They give a clearer picture of what's happening right now in your body. In some cases, especially if you have severe symptoms, unexplained weight loss, or other warning signs, your doctor may recommend an upper endoscopy. This is a more involved procedure, but it provides valuable information. During an endoscopy, the doctor uses a thin, flexible tube with a camera to look directly at your stomach lining. They can also take a small tissue sample, called a biopsy, to test for H. pylori and check for any damage or other conditions. Endoscopy is considered the gold standard for complicated or unclear cases, especially when other tests are inconclusive or when there are serious concerns. However, most people won't need an endoscopy unless there are specific reasons or red flags. For the majority, non-invasive tests are more than enough. The good news is that testing for H. pylori is straightforward, effective, and helps your doctor choose the right treatment plan for you. Early diagnosis can prevent complications and speed up your recovery. So, don't delay if you have symptoms. Getting tested is the first step toward feeling better and protecting your digestive health. Your doctor will help you decide which test is best for your situation, ensuring you get the answers and care you need. The good news, H. pylori is treatable. The goal is to wipe out the bacteria so your stomach can heal. Treatment usually means 2 antibiotics plus a proton pump inhibitor, PPI, for 10-14 days. PPIs, like omeprazole, reduce stomach acid, helping antibiotics work better and easing symptoms. Sometimes, a 4th drug like bismuth is added for extra protection, especially where resistance is high. This quadruple therapy is powerful and effective. Your doctor will pick the best combo based on your history and local resistance patterns. Side effects are possible, but most people tolerate treatment well. Clearing the infection reduces your risk of ulcers and cancer. Stick with the plan for the best results. Modern medicine makes H. pylori a problem you can beat.